So we're going to work with levator scapulae. We're going to use SMRT to do it. So levator is this muscle that's attaching up here along the superior angle at the medial border above the scapular spine of the scapula. Tends to hold a little bit of tension. Again, I would tell you that levator is typically in a tug-of-war between what's happening at the lateral border and what's happening up here in the cervical vertebrae, because it originates from the transverse processes of C1 through C4. So you'll have to look at what's going on with the cervical vertebrae and what's going on with the lateral border of the scapula to get any real release in levator scapulae. Oh, got some here. We're going to come down through here. Just kind of palpate a little bit. All right, so you can kind of see I'm kind of flipping over the top of that muscle. So let's do our basic SMRT releases. So this is our muscle right here. Now I'm going to move that hand so that we can see. I'm going to come in and I'm going to put the inferior angle of the scapula into the crook of my thumb so that my thumb is on the lateral border, and at this moment my index finger is on the medial border. Then I want to take my index finger and put it on the posterior aspect of the scapula. Now I'm going to move the scapula with my thumb, medial and superior, so that I'm elevating the medial border of the scapula. That's the main action of levator. Then I'm going to use my index finger and I'm going to come down toward the rib cage. So as I bring the scapula toward an anterior plane, I actually straighten out the origin and the insertion of levator, or I attempt to. I move in that direction. That's going to create a further shortening of the muscle. So let's describe that a little bit differently. So our insertion fibers are here in a posterior plane, and our origin is here in an anterior plane. As I push down on the scapula, bringing it more anterior, I try to line up those fibers. Right? Now, am I going to get there? No, I'm never going to line them up. That would break her, right? But as we move in that direction, we get a nice secondary shortening of the muscle tissue. So let's do it again. Inferior angle in the crook of my thumb, index finger on the posterior aspect of the scapula. Move with your thumb from the lateral border, move the scapula medial and superior so that you're elevating that medial border of the scapula. Then take the index finger and press anterior down toward the rib cage. This gives you a nice secondary release in serratus anterior and subscapularis as well. So if you have any decreased space between the scapula and the rib cage, this is actually going to help with that as well, which will release both of those muscles. Okay, let's come back up here and let's feel it. It's looser, but we still have a nice knot up through here. Okay, so this is right at the attachment that we have that issue. So our second release is we're going to use the scapular spine. We're going to come to the inferior edge of the scapular spine, right at the medial portion of that. So this is a little bit hard to tie into. There's just a small divot there. You're going to put your fingers into that divot and move very small toward the fibers of the insertion. So just like that. So we're moving toward the head, but we're barely moving. Okay, so this will open up those fibers at the attachment site, at the insertion, that area that tends to get a little bit like crunchy in there. Okay. Sometimes as we come up through here, remember that levator's coming in above the scapular spine, so right into the medial border, right up through here. But she has tension that kind of comes around the superior angle, right at the superior border right here. That could actually be omohyoid. So let's check fiber direction of that. And it is. So the omohyoid belly is going to travel across the top of the shoulder toward the clavicle. And that's what that muscle is right there. We can just cross fiber it, move back and forth over the top of it. Levator is going to travel up into the neck. Levator itself is actually pretty loose right now. The tension that I'm feeling through here is actually the inferior belly of omohyoid. And that is another video. So we're not going to do that right now. But do look for that video, for the video for omohyoid, because that can pull the scapula toward the clavicle like this, which can actually shorten levator. So for levator, again, we want to check out teres major and minor and lats. We want to check out what's going on with the rhomboid muscles, because they also pull the scapula into adduction and elevate that medial border. And we want to look at all the videos for omohyoid.